Well, it's time now for a Thursday Health Update, and joining us now is Africa 54 Health reporter Linord Moudou with a look at tropical diseases. Hello, Linord.
Hello, Vincent. Hello, everyone. The World Health Organization is urging countries affected by neglected tropical diseases to scale up their investment in tackling 17 entities in order to improve the health and well-being of more than 1.5 billion people. WHO's new report, Investing to Overcome the Impact of Neglected Tropical Diseases, outlines an investment case and essential package of interventions for these diseases. Neglected tropical diseases like dengue, rabies, sleeping sickness, and leprosy cause blindness, disfigurement, permanent disability, and death, particularly among the poor. Dr. Dirk Engels is director of the Control of Neglected Tropical Diseases Department with WHO.
This report makes the case for countries to generate their own financing for the control and elimination of the neglected tropical diseases. This will be crucial to ensuring that everyone has access to the same kind of public health coverage for these diseases, which have always been associated with poverty.
And an annual investment of $2.9 billion is required until 2020 to reach targets set in the WHO roadmap for 2015 to 2020. Annual investments will continue to decrease as diseases are reduced or eliminated. And the World Health Organization has launched a new policy on injection safety to help all countries tackle the pervasive issue of unsafe injections. The WHO also announced that smart syringes that break after one use should be used for injections by 2020. Syringes are also being engineered with features to protect health workers from needle stick injuries and resulting infections. Use of the same syringe or needle to give injections to more than one person is driving the spread of a number of deadly infectious diseases worldwide. Here is WHO Director General Dr. Margaret Chan.
With more than 16 billion injections given every year, we cannot afford to have any of them administered in an unsafe manner, and the risk of transmitting disease is too high. Of these 16 billion injections, 90% occur in therapeutic services. Unsafe injections can spread several diseases, among them hepatitis B, hepatitis C, and HIV. And these are heavy burdens in terms of creating additional work for the health system.
The WHO is also calling for policies and standards for procurement, safe use and safe disposal of syringes that have the potential for reuse in situations where they remain necessary, including in syringe programs for people who inject drugs. And in Ebola news, tests have shown that the disease can be transmitted through sex after a patient has overcome the virus. Researchers say traces of Ebola can remain in semen of some survivors for at least 82 days after the onset of symptoms. They say it stays in vaginal secretions for a much shorter period. Scientists say the testicles are a reservoir for Ebola because white blood cells, which protect the body against infectious disease, are unable to effectively destroy the virus there. The World Health Organization advises Ebola survivors to abstain from sex during a 90-day period following recovery, or, failing that, well, to practice safe sex. Lynn Vereen is medical coordinator at the Ebola Treatment Center in Monrovia, Liberia.
There has been some facts that the semen is still infective for 90 days after the onset of the symptoms. In that case, every male survivor that is leaving our structure, we give them for that period of time condoms, because we think it's very important that when they have sex, they have protected sex. So we explain that very well also to the survivors.
And observers say the sexual transmission of Ebola has raised the prospect of new infections, even in areas free of the disease, just as the year-long epidemic appears to be receding across the region. And that's your health report for today. Back to you, Vincent.
Well, Linord, thanks a lot, and be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.